The VALSALVA Pulse Test Module. The VALSALVA Pulse Test is a medical diagnostic test that is used to evaluate the function of the autonomic nervous system and to diagnose certain medical conditions. During the VALSALVA Pulse Test, the patient is typically asked to take a deep breath, hold it, and then forcibly exhale while closing the mouth and nose within 15 seconds. This creates a transient increase in intrathoracic pressure, which can affect the heart and blood vessels, causing changes in blood pressure, heart rate, and heart sounds. Normally, during the strain phase of the VALSALVA test, there is an initial increase in heart rate and blood pressure, followed by a decrease in heart rate and blood pressure during the release phase. The VALSALVA pulse test evaluates the heart rate response during the release phase. If the heart rate does not decrease appropriately during the release phase, this may indicate autonomic dysfunction or other medical conditions that affect the cardiovascular system. Next, let's look at an example of a VALSALVA pulse test using the LifePulsePro diagnostic system. The pulse sensor is checked before starting recording. Then we will activate the module. The first stage lasts 15 seconds, when the patient holds his breath with tension. We see an increase in pulse rate and a decrease in signal amplitude. This means a decrease in capillary blood supply. At the 15th second, a beep sounds. The second stage begins. The patient exhales slowly and breathes calmly in the second stage of the test. We see a decrease in heart rate. The full recording lasts 45 seconds. After resetting the timer, a graph of the recorded signal and a rhythmogram are displayed on the screen. We can see the color spectrum of the cardio intervals as well as the pulse pattern too. Yellow color corresponds to increased heart rate. Blue color reduced heart rate. The software analyzes the ratio of cardio intervals and gives the result. We got the coefficient equal to 1.53, which corresponds to the norm. There are no signs of cardiac autonomic neuropathy. The VALSALVA test via LifePulsePro allows us to diagnose some of the signs of cardiac autonomic neuropathy even at the preclinical stage. Cardiac autonomic neuropathy has a strong influence on various heart diseases. Early diagnosis of signs of cardiac autonomic neuropathy may improve prognosis and reduce the risk of adverse cardiac events.